ABC 10 News starts now with breaking news.
Bottom line is, wear those damn masks out there, socially distanced, and the sooner we do that, the sooner we're going to get through this crisis.
The pressure of surging COVID cases reaching a new milestone in San Diego County. The sheriff pledges a crackdown on violators, and the state issues a limited stay-at-home order effective this weekend. Thank you for joining us. I'm Kimberly Hunt, and we are following major developments announced just in the last 90 minutes, beginning with a limited stay-at-home order imposed by the governor. Starting Saturday night, all non-essential operations and gatherings in San Diego County are prohibited between 10 p.m. and 5 a.m. The order lasts for 1 month through December 21st. And the San Diego Sheriff's Department says it is stepping up enforcement, working with county compliance officers to investigate complaints, give citations, and require businesses to close.
We are ramping up and enhancing compliance as well as testing with the increased number in cases and the surge in the number of cases that really are numbers that we have not seen ever in the course of this pandemic.
Today, there are 899 new cases of COVID-19 in San Diego County. That brings the total to 68,140. The amount of San Diegans who have died from the virus remains at 945. It is not just San Diego County getting a limited stay-at-home order. Much of the state is under these new restrictions. ABC 10 News reporter Laura Acevedo is live with how the order will work here and across California. Laura.
Yeah, Kimberly, and basically this order, or this curfew as it's being called, applies to all counties that are in the purple tier. And as mentioned, it will start Saturday night from 10 p.m. until 5 in the morning every single night until December 21st. That is a month from Saturday. Now, state officials are calling this a limited stay-at-home order, and what it means is that all non-essential work and gatherings will have to stop by 10 p.m. Here is what you can still do. You can still do things like go to the grocery store or pharmacy and get things like takeout or walk your dog. Now, the state's Health and Human Services Secretary, Dr. Galley, had a press conference within the last hour, and he says that this is necessary to avoid further restrictions and stop the surge of cases that the state is seeing right now.
We know, and we've seen in the past, that COVID goes from 0 to 60 miles per hour very quickly. That we're in a place today, but that can rapidly change. Maybe not statewide, maybe just in a handful of counties, but further restrictions is what we hope to avoid.
So again, this order is in effect for all counties in the purple tier. Once again, it goes into effect Saturday night from 10 to 5 in the morning until December 21st. Reporting live, Laura Acevedo, ABC 10 News.
Thank you, Laura. San Diego County leaders have already issued more than 50 cease and desist orders after we went into the purple tier last weekend. ABC 10 News reporter Jennifer De La Cruz has how the sheriff is now cracking down on those who don't comply.
The county didn't originally plan for a press conference Thursday, but scheduled one last minute with this dire warning.
Right now, this pandemic is a runaway train that is barreling across our nation and across our state and across our county. And we need to slow it down.
The county announcing an increase in enforcement of the public health order. They're enhancing their partnerships with the Sheriff's Department for not only the county restrictions, but the new state curfew from 10 p.m. to 5 a.m. for non-essential activities. Sheriff Gore says they've created 4 teams that each consist of 2 deputies. Those teams will work throughout the county alongside public health officials to get compliance after they've received a complaint.
When we can't mitigate the situation that we're dealing with, that's when deputy sheriffs are there to take enforcement action, either through citations or writing case reports.
The county has issued 52 cease and desist orders to businesses like restaurants, gyms, and places of worship since Monday. District Attorney Summer Stephan and San Diego City Attorney Mara Elliott now dedicating members of their staff to enforce any citations.
If the entity does not want to come in compliance, they will be issued a citation. And at that point, the district attorney or city attorney, if in the city of San Diego, we'll take it from there and ensure appropriate follow-up on enforcement of the citation.
The Sheriff's Department says they're also working with police forces in local cities to get compliance there as well. Jennifer Dela Cruz, ABC 10 News.
Anyone wishing to file a complaint for a violation of the health order can do so on the county website. And we have an interactive map showing the zip codes with the highest number of cases in the county. You can track the fight against COVID-19 on 10news.com.
The CDC is now urging people not to travel for Thanksgiving. New guidelines out today say the safest way to celebrate is at home with the people you live with. Anyone not there 14 days prior to the holiday doesn't count. That means college students or military members coming home should be treated like a guest with limited contact. If you gather anyway, limit who prepares and serves food, sit outside 6 feet apart, and wear masks as much as possible. The increase in COVID-19 cases we're seeing is stressing the system for testing. We're seeing lines like these. The companies that make the tests and supplies needed for them are just trying to keep up with the demand.
Those companies were operating on an allocation basis, and that just means they're basically everything they make is going out the door. There is no reserve. So if there's an increased demand in a lab for testing, there's no more reagent to be had. So to meet that demand, that lab has to use a different manufacturer's test.
Kelly Robleski is with the Association of Public Health Laboratories. She says along with getting supplies, there's the issue of human resources. There's only so much lab capacity and only so many trained people to provide the testing. The American Clinical Laboratory Association says a surge in demand for testing means some labs could reach or exceed their current testing capacities soon. That means it could take longer to get your results back if you get a PCR test. Robleski says the PCR result can take anywhere from 24 hours to a week right now. With antigen tests, you get the results back in less than 30 minutes. The supply of those tests is good now, but not everyone offers them. Both lab groups stress testing is important, but you have to be strategic about it.
There's been a lot of emphasis put on testing, but testing is only one piece of the puzzle. It gives you some information, and if you're not going to do anything with that information, whether it be targeted closures, whether it be staying home and isolating, we're not going to stop spread of disease.
As far as getting more tests, that's going to take a while. She says it takes 6 months or more to significantly increase production capability. Labs don't expect to see the ramp up in supplies until the first part of 2021.
While many houses of worship have moved outside or online, others are fighting to remain open. ABC 10 News reporter Mimi Alcala explains how a lawyer is defending churches by taking the battle to the U.S. Supreme Court for a second time.
As COVID-19 cases continue to rise across San Diego County, many houses of worship have moved services outside or online to be in compliance with the latest restrictions. But others say it infringes on their religious rights and they will stay open for indoor services.
The restrictions on houses of worship are arbitrary, but no matter what size the church is, right now they're closed indoors.
Paul Jonah is a lawyer representing religious leaders and churches in 3 separate legal battles in LA County, Kern County, and right here in San Diego County.
Churches are entitled to heightened protection. If you're going to restrict the fundamental right to exercise religion, which is protected under the First Amendment, you need a really, really good reason.
The local church, South Bay Pentecostal, has been here with Jonah before. They took the fight all the way to the U.S. Supreme Court a few months ago and lost in a 5-4 decision, but they're not backing down. Jonah says he submitted a petition to the Supreme Court Thursday calling for an emergency review of the case, which asks for houses of worship to be allowed to reopen inside.
And we also think that the dynamic has changed right now with Justice Barrett being confirmed to the U.S. Supreme Court.
Doctors, state, and county health officials have repeatedly said indoor gatherings are dangerous during this pandemic, as the coronavirus can easily spread inside. According to the county data, out of the more than 7,000 COVID-19 cases reported in the first 2 weeks of November, 168 possibly came from places of worship. Jonah says his client, Bishop Art Hodges, a pastor at the South Bay Church, is doing all he can to make sure worshipers are safe.
He requires people to get temperature checks. He requires, he's complying with the mask, the social distancing, everything, and ventilation systems.
Bishop Hodges tells me since reopening, he has seen 0 COVID-19 cases as a result of being in his church. Mimi Alcala, ABC 10 News.
And so far, the county has cited 2 churches refusing to close indoor operations.
Another positive report from a third maker of a possible COVID-19 vaccine. The AstraZeneca Oxford University vaccine is reportedly highly effective in the most vulnerable. Data published in a medical journal today suggests those over the age of 70 could build a robust immunity to the virus with the vaccine. It's still in phase 3 trials, and we should get more specific data next month. The early data that we've gotten from COVID-19 vaccines show that they are on par with some of the most effective vaccines for other diseases. Remember, the government only set a goal of at least 50% effective for a COVID vaccine, and they're coming in the 90s range. COVID is frequently compared to the flu, but based on these numbers alone, stopping the spread of the virus could be a lot faster than the flu if people are willing to get the new vaccines.